Hi, thanks for taking the time to view our poster. Firstly, let me tell you a bit about who we are. The Sydney Children's Hospital Network includes both Sydney Children's Hospital Randwick and the Children's Hospital at Westmead. Together, last year we cared for over 150,000 children from across Sydney, New South Wales and beyond, with over 50,000 admissions and approximately 90,000 presentations to both emergency departments. We're proud to be sharing our quality improvement project, utilising hospital data to inform falls prevention education with you. Hospital-based paediatric falls are largely preventable, yet falls continue to occur, resulting in significant harm and in some rare cases death. In developing targeted education and strategies to reduce falls and improve safety, it is critical to understand and measure what parents, carers, young people and staff know about falls that occur in the hospital setting. Our aim was simple. It's important to understand the gaps in hospital-based falls knowledge. We were data-driven, so we used our hospital data to inform targeted education in our key stakeholders, our staff, parents, and of course the child. And finally, to determine innovative ways to improve the delivery of falls education to these key stakeholders. So how did we do it? Firstly, we established a monthly multidisciplinary falls prevention meeting. As part of the Quality Improvement Project, we established a number of focus groups to explore and better understand the use of risk assessments and management plans. We collated and analysed our falls data, and we used this as well as national and international literature and our previous research findings to inform our falls prevention, education and tools. This included the development and implementation of a short and sharp targeted falls education video, engaging paediatric consumers and clinicians, as well as the electronic falls injury prevention and management plan. What we found aligned with international and national literature. That is, that parents are frequently present at the time of a fall. Of our total falls, 42% involved a fall from a bed or a cot, and 40% of these occurred whilst the bed rails were down. 17% fell from a chair, pram or wheelchair when their seatbelts weren't fastened. And less than 1/3 of parents' carers received falls prevention education on admission or whilst on the ward. And there are also inconsistencies in staff completing and documenting a falls management plan and risk assessment, as they were considered too cumbersome by some staff. But most importantly, 67% of falls were deemed preventable. And this, of course, was an important driver for our project team. So how do we use the data? So using quality improvement methodology, we came up with two separate change ideas. The first involved education. So we developed and implemented our falls education video, which was informed by our data, as well as engaging our key stakeholders, our staff, parents, and the child. We also simplified our falls injury prevention and management plan to reduce documentation time, as well as providing prompts to clinicians in implementing strategies to prevent a fall. This was embedded into our electronic documentation system and aligned with existing electronic falls risk assessment. The management plan is auto-populated for any child scoring a 12 or above on the validated assessment tool, which is considered high risk of a fall. The management plan then prompts clinicians to educate and empower the parent, carer and child on falls prevention, as well as providing routine and high-risk care actions relevant to the child's risk. These form parts of the child's falls prevention and management plan. The management plan then prompts clinicians to educate and empower the parent, carer and child on falls prevention, as well as providing routine and high-risk care actions relevant to the child's risk. These formed parts of the child's falls prevention and management plan. We continue to evaluate our project and we encourage you to contact us if you have any questions or would like to share your experiences. Thank you.